The lack of drugs at the various infirmaries of prisons across the country is said to be impeding the provision of adequate health care to inmates. The situation has become dire that the health centers have had to resort to the benevolence of the inmates at the prisons. Chairman of the Ghana Prison Service Council, Reverend Steve Wengam, who disclosed this in an interview with ZTV News, described the situation as unfortunate and said it requires urgent attention from the state.
Currently, the only option we have is incarceration. That is why our prisons are choked. You go to Nsawam medium prisons, the capacity is 850. It is housing over 3,500 inmates. You go to Kumasi central prisons, is meant for 450. It is accommodating 2,500 inmates. This is harsh. This is wickedness. This is inhuman. I mean, our brothers and sisters don't deserve that. You may say that, well, they are criminals. Not all of them are criminals. 21% are on remand. And even if they are, well, they deserve a better chance, a second chance, so they can reform and be rehabilitated.
Meanwhile, Reverend Wengam has made a case for the prisons to be provided with their own hospitals to meet the healthcare needs of inmates as well as prison officers and their dependents. He decried the absence of a hospital for the nation's prison, considering the number of inmates and prison officers that are currently in the system. The chairman of the Prisons Council further appealed for government and private sector support to facilitate the construction of a hospital facility.
Since hospital as a matter of agency, we have a police hospital that is and that is a drop in the ocean as compared to the 25 million Ghana cedis we need every year to be able to implement our 10-year strategic development plan. We are asking philanthropists, we are asking corporate bodies to adopt any of our 43 prison facilities and say every year we'll go and renovate the place, or we'll build a washroom for you, or we will stock your maybe skills training centers with training tools. If we can all do that, we can transform Ghana prisons and make Ghana prison centers of excellence within a matter of time.
The National Health Insurance Authority (NHIA) has already announced plans to license the Nsawam prisons to submit names of inmates that are on the scheme for the payment of claims. The NHIS move seeks to support calls for reforms proposed by the Ghana Prison Service to improve the welfare needs of inmates to conform to United Nations standards.